Hi, everyone. Welcome back to Let Me Know If You Need a Podcast. On this episode, we talked to Julie Rudman. Julie was diagnosed with breast cancer in summer of 2023. And as she describes it, she had the best case scenario. She'll tell us more about that soon. But she also was reflective enough to realize that not everyone has that best case scenario. And she asked herself, how are other people doing this that were not as fortunate as her? She basically took that experience and turned it into something amazing. She started the Breast Cancer Club specifically to Kansas City at this time. We're going to talk to her about survivorship, community, what it means to show up, and how she is managing all of that. So let's jump in and learn more. Hi, everyone. Welcome back to Let Me Know If You Need a Podcast. We are here today with Julie Rudman, founder of the Breast Cancer Club, and we're very excited to talk about her and her experience. Hi, Julie. Thanks for joining Kristen and I.
Thank you so much.
So good to see you, Julie.
You as well.
So, Julie, I know the story, but fill the rest of us in, and maybe I'm sure Kristen would love to hear it from you too, but take us back to like what got you into this space. How did you end up in the breast cancer space? What's your personal story that ties you into this?
Mm-hmm. Breast cancer.
Yeah.
Well, I do have to explain that a lot of the times because people wonder until I say that I'm a breast cancer survivor. So in July of 2023, I showed up to a routine mammogram and they found something. You know, the subsequent diagnosis, looking online for support, being shocked at how little I could find in Kansas City, understanding the need and realizing that if I needed help with all the advantages and privileges that I had being married to a doctor, you know, we can go into that. Realizing that if I needed help, lots of people needed help.
Yeah. So it's interesting because I think you and I have a very similar perspective on our realizations when we went through this process, because I was a healthcare provider. Mm-hmm. You were married to a healthcare provider, right? Yeah. So we have very good, like you said, very good access to medical knowledge. And you would think we would have the best access to any resource. So tell me a little about that, like realization and how that prompted you to move into what you're doing now.
Yeah. I just started realizing I didn't understand how people were doing this because it's hard. So like I didn't have a job. I wasn't missing work. I wasn't trying to schedule 20 radiation appointments around
and keep your job. Yeah.
Right. I live right by my treatment facility. I drive past it every day.
Right.
And, I've come to realize that people are coming 2.5 hours sometimes into the city for care. Realizing that I had friends and family. I've lived in Kansas City since 2000, and I'm from here. So, what do you do if you're new in town? What do you do if your job and your kids are your focus and you have not had time to build a support network?
Yeah.
What do you do if English is not your primary language? Mm-hmm. And realizing we knew the language. We were not looking at words. My husband diagnosed with hundreds of cancer patients. This was not...
Yes. Yeah. And I think it's important to say you knew the language from a medical standpoint.
Yeah.
But also just literally the language of support in a country, or
yes.
How do I arrange transportation here? How do I schedule my appointment? If I don't speak the language, I have to call the receptionist. All these things, it's like every step of the way is going to be harder.
Yeah. I know. And I just kept wondering, I don't know how anybody is doing this. Mm-hmm. When I was diagnosed, it was Friday around lunchtime. And I remember thinking, because, you are so anxious and waiting is awful. And my husband came home from work and placed the phone call and got me an appointment. Because I remember thinking, if we don't get an appointment by close of day,
you're sitting all weekend.
All weekend to chew on that. But I thought afterwards, how was who would I have called? I don't even know who you called. My husband just called and took care of it, and I had my care at the place where he has worked. I understand that is incredible privilege. and that the doctors were known to us, you know?
Yeah, but it takes a special person to recognize their privilege, right? Because I think a lot of us go through the situation and, we maybe have a friend or an acquaintance that can help us kind of navigate the medical part, and we have a support system. And I think it says a lot about you in the time to say, wow, like, I'm super fortunate that I found this out, and then I have a plan essentially hours later, right? And so how did you what have you done with that, I guess?
Well, pay it forward. Yes, acknowledging and being grateful for my good fortune. And that was, 20 something years worth of goodwill that, my husband had built up in the community and all of that. So
is your husband an oncologist? What kind of medicine does he practice?
Ear, nose, and throat, head and neck surgery.
Okay.
Yeah. But he's, yes, of course, had hundreds of cancer patients and,
Sure.
And obviously knows who he refers to people to, and he likes in the OR and all of that kind of stuff. So,
yeah.
So I would say deciding not to feel guilty or shameful over that, because those are not helpful, productive emotions, but framing that as gratitude and what can I do now that I understand how difficult this is, how little support is out there, and how many people are really not in a great spot as they enter into cancer.
So walk me through the timeline. You're going through treatment and you're already thinking like, I know I need to start something, or you did your treatment and then you're like, okay, now I'm jumping in, I'm starting something.
No, I knew I would, within a week probably. I remember exactly where I was in a parking lot when just had the idea for the Breast Cancer Club. Didn't have the name yet, but knew I was going to do something. It was before my treatment. I had actually been connected with somebody that we knew each other by face, and another a mom at at the high school, and she sat down with me for hours and mentored me before I went through it. And I said at the end of that, Shannon, I don't know how to thank you.
Yeah.
And she said, pay it forward.
Yep.
And it was the next day. Remember exactly where I was, and I just knew it was a knowing of what I would do and what this would look like. Although it's evolved, but so I knew that. And then I lay in bed recovering from surgery, researching available domain names to figure out, because you can have an idea of what you want to call something, but you've got to be able to get that domain name. And was shocked when the Breast Cancer Club was available, because
that is a bit shocking, isn't it? Like, how is that still available?
I know everybody calls this either a club, a sisterhood, or a sorority. So I went with the non-gendered word because, of course, anyone can get breast cancer, right? Every human has breast tissue, and if you have tissue, you can get cancer. So
I have a question about, so support is like a very broad word. Obviously, it can manifest in so many different ways when you're diagnosed. Was there a specific type of support you were looking for those initial moments? I mean, it sounded like you really wanted a mentor. You wanted someone to maybe provide a little bit of inside baseball, but like, was there anything else specific that you're like, man, I cannot believe I don't know how to find XYZ?
Yeah, like I assumed that there would be groups if you got together. I mean, I think there used to be. Definitely for the younger women, there used to be a group that had a giant gala every year that drew like 500 people. And, all this stuff is gone. Susan G. Komen pulled out of Kansas City in 2019. And, a lot of the small organizations have closed since then. COVID didn't help. But everything that I looked up, that anything I'd ever heard of was gone. So, of course, Susan G. Komen, I knew the name. I didn't exactly know what they did, but we did a walk every year on behalf of a woman in my husband's office. And, they closed here. Like I said, it's 2019. I looked up the block cancer, family cancer. There's a statue by the plaza, a cancer survivors park. So I knew that they had done something. And they did have a wonderful hotline at one point, but that now rings in Kentucky, I think. And it's just a legacy website. And then I knew something called Back in the Swing just because it was my friend's aunt who ran it. But, it just didn't exist.
Didn't exist. So when you first came out, tell me how the Breast Cancer Club first goals were and then how that's evolved or what you've kind of noticed over time that needs more support.
Yes, it has definitely evolved. So like I said, my cancer was in July, end of July 2023. And then I was, just doing research and planting seeds all through the fall, wrapped up my treatment in early November of 2023, and the Breast Cancer Club launched November 20th.
Amazing.
Of 2023. Our paperwork was filed in the state of Kansas. So, found people to serve on a board and worked on that. We got our 501c3 status in February of 2024. We launched the website in a soft launch June 1st of 2024, just with 20 or 30 people that we knew who would test out the links and just make sure that page directs where we say it does. Started getting the materials out in hospitals and other locations in the fall of 2024. By June of 2025, by the 1-year mark, we had 200 members, but we know our impact is a lot greater than that because anyone can look at the website. You don't need an account unless you want to post on it or unless you want to take advantage of our discounts, which is something that we added this past year.
So this is nationwide. It's not just Kansas City area.
No, it's just Kansas City.
Okay.
You have to check a box when you register to say that you live in Missouri or Kansas. A lot of the information is widely applicable. However, you can't use our discounts and it doesn't help to review an oncologist if you don't live in Kansas.
So anybody, of course, can visit the website, but you're specifically curating resources more locally.
Yeah.
Okay.
Yeah.
And
so I'm sorry, I didn't answer your question. How it has evolved. Actually, in a few different directions. When I come up with ideas and everything kind of makes sense to me because it was my brain, got the ideas other people look at things that it was a little overwhelming. There's a little too much stuff.
I have no idea what that's like.
Somebody told me yesterday there's always an idea person and an integrator. And one person, the brain is going like this, and then the other person figures out which ideas.
The action steps.
Yeah, I think we figured out who y'all are. So realized that maybe we had a few too many features, and I've gotten feedback. Then we've made some modifications that there were a few too many menu items and things like that. So we've simplified. I've deleted a lot of stuff that it still lives on the staging site, and maybe someday it comes back, but not right now. There's been a lot of
iterations.
Yeah, and then just the more I talk to people, I think of other things that we need. So
I love that because it's like keeping the person that you're hoping to serve at the front, right? So listening to them, because we all have we come out hot with these great ideas and then we realized, okay, man, that maybe not great in execution and that's fine. What are you finding now that seems to be resonating most with people? I know you're doing the walks and the kind of the meetups, which is lovely.
I'll tell you what really resonates is discounts. We started adding discounts at local businesses that offer products or services that would be helpful if you've had breast cancer or trying to prevent breast cancer or breast cancer recurrence. So we have discounts at Kansas City businesses that are gyms, healthy restaurants, juice places, massage places, stretch places, hair places, on and on.
Beautiful.
Mobile labs and the infusions, all the hyper wellness sorts of things. And we continue to add to that all the time. The last one I added was Clothes Mentor, which is a consignment store because a lot of people go through some size changes. In either direction, massive weight gain or massive weight loss quickly, faster than most people can replenish a wardrobe.
So it's so interesting because that it makes it so clear how financially difficult this can be for a lot of people, because if that's what's pulling people, that's what you're seeing a lot of traction on. Obviously, that's an issue that needs addressing, right?
Yeah, we're all right. And cancer is stupidly expensive, when you have health insurance.
Yes. And then I see a lot of things that you do. You collect like physical items, correct? Mm-hmm. And that is...
Yes. One of the problems that we identified pretty early on, there are some things that you need when you go through cancer, especially if you're going through chemo. You don't need them very long, and they're expensive, but that means there's a lot of really good, gently used stuff out there, and nobody knows what to do with it. There used to be a breast cancer thrift store in Kansas City. It was called Battle Boutique. It was across from Oak Park Mall.
Oh, okay.
In the Quivira area. That closed in May of 2024. And since then, nobody has known what to do with their stuff. Mm-hmm. Some people will hold on to it and wait until they hear of somebody who needs it. That only works in communities where people are connected and are public about their breast cancer.
Yeah. Mm-hmm.
And there are a lot of communities where that is still a taboo topic. You don't know who to ask for stuff. You don't know who to give your stuff to.
Right. Well, and you don't know how comfortable people are sharing or taking hand-me-downs, and you don't want to offend people, So I love that, because I know from experience that you do buy a lot of stuff that you're hoping to never use again, but you would also like to be helpful to other people.
Right. Yeah, exactly. So we get, the wedge pillows and body pillows, lots of post-surgical bras, wigs, drain management clothing, and clips, and seatbelt cushions, and all of that kind of stuff. So we have a wonderful community partner with Goodwill. There are 16 Goodwills in Kansas City, and they are our community partner in that. So anybody can take something that they would like to get to a breast cancer patient, mark it for the Breast Cancer Club, take it to any Goodwill, and they will see that we get it so we can give it out for free.
Brilliant. And then how are you identifying people that have that need? Like, how are you matching your stuff with your people?
Every once in a while, it's somebody who reaches out, but in large part, we are working with nurse navigators and this is,
So
yep.
Tell me.
We also collect bras. So it doesn't.
I see that.
It doesn't just need to be cancer patients who have cancer goods per se, but a lot of people just need a new size or style of bra.
Yeah.
Because of their treatment, you can go through many different sizes because of swelling, or you might have surgery and then spacers, and then 12 weeks later your implants, and then you're swollen, and then
you don't want the underwire, and then you want the underwire, and
Right. Or, you might lose your mobility. You won't be able to reach around to the back. So you want front closure or so, and anybody can help with those. So we call that initiative Bras for a Cause. And anybody can do bra drives. We've had individuals do bra drives. We had one person who asked for bra donations in honor of her 43rd birthday. It was the year she had cancer. And she hoped to collect 43 bras, and she collected 340.
Amazing.
We had the Kansas City Chiefs women's organization did a collection for us. We had all 10 YMCAs do massive collection for us. And so, and then I have teenage volunteers who inspect those and sort them and put them on hangers and on commercial racks, and we get those. Yeah. I cut you off. What'd you start to say?
That's a great question. Brain fog is a real thing, but let's see what I can pull out of from the depths. I think what I was going to say was something about, what have you heard from people? So like, I know you're very involved, and I went to one of the walks at the mall. You meet up, you have a group. Julie seems to know everyone by name, which is amazing. So she kind of does this. Well, name tags. I know. I love a name tag. I think name tags should just be a requirement in life. Yes. Yes, it would be super helpful. But talking with individuals, what have you heard that has been, what has been helpful? Have you heard I love an inspiring story. Anything that you're like, man, I'm glad I'm on the right track. I'm doing the right thing here.
Yeah. Well, I actually don't get to experience a person's interaction with our website or service very often. So I can deliver bras to the hospital and interact with the social workers and the nurse navigators who are grateful for them. I don't get to see the women shop off the rack and select their bras, and I just don't get to. So, or I don't get to see people experience our website very often. I did get a text the other day. A friend of mine knew somebody who was diagnosed, and she sent her the link, and then the woman sent a text, and then my friend screenshot for me so that I could see it, because I don't get that very often. And it was, I'm literally sobbing on my couch that this exists, and so grateful. So, that's great. I don't get it very often, but
clearly, like when you're bringing more bras to the nurse case navigators, and so that this is something that
I know something they need. Yeah.
Yeah.
Yes. We are out in the community a lot, and I do get to interact with people there who go, and that's how I know also that they're so excited about the discounts, is because, so yeah, everybody who wants and needs to save money. We also have a grocery store discount where we have 25 grocery stores that participate. So one member a month gets to save 10%.
I saw that pop up. I love that.
Bill. But yeah, I don't get to experience it a lot, but what I really love is bringing people together and connecting people. And sometimes that's, like at a mall walk, and sometimes it's, I know somebody's story and I know who to connect them with. So we had a 31-year-old, and she doesn't know anybody her age going through breast cancer. But I said, I know a 31-year-old. And so, I was able to connect them, and they, were able to text through that. We had an event that we did in conjunction with Gilda's Club, where we had a young mother pregnant with her second child going through breast cancer treatment. And one doctor had advised her to terminate the pregnancy, and another doctor said, no, there are chemo agents that are safe. So she kept the baby and had to have a little break during chemo to deliver the baby. She just had her reconstruction and is back in chemo again. Baby's healthy. But when I heard her story, we were able to, connect her with two people who had breast cancer while pregnant. And, they could mentor her. We got her all the stuff she needed, signed her up for a recliner lift chair, got her a discount at her grocery store, all of that kind of stuff. I can't imagine. I mean, I can't imagine.
Unbearable.
Right.
So I have a question for you. Apart from obviously the challenges of experiencing and treating cancer, what was the hardest struggle with getting the Breast Cancer Club up and running? I mean, you have to network so much. You go out to these places. You can't be everywhere at the same time. Like, what was the biggest challenge for you to get this off the ground?
Well, I will say that it's not without challenges, but I will say it has been an unbelievably smooth and quick process, because the good people of Kansas City recognize the need and are always passing me on to the next person that I need to be able to talk to. And, let's be honest, I'm very lucky. I'm, married to a doctor. So getting, the hospital where he practices medicine to put our materials out was not hard. Most of these things have gone pretty smoothly. And again, I've lived here for, I lived here for 25 years at that point, and just knew some great people, and great people know other great people. And so I've really been fortunate. What I will say is I had no background whatsoever that would apply.
Mm-hmm. So, lots to learn.
I had lots to learn.
Yeah.
I have not had a job since the last millennium. I have not worked since 1999. I was a high school English and French teacher. Then I was a stay-at-home mom for 25 years.
Yeah.
So I had to have a friend teach me how to Zoom. Like we sat in the kitchen with our laptops. Like, why would I know?
Yeah, totally.
We've all had a friend teach us how to Zoom.
Yeah.
I was taught how to fax. My first job, I was like, I don't know how to fax. I have no idea what I'm doing.
Yeah. I really did not have the skills. So yeah, my friend and I sat in her kitchen with our laptops and, practice Zooming. I'm still not sure I look at the right place when I'm talking, but, so I've just had to learn so many things. But it's great. I love to learn. I wondered what my next chapter would be. I'd been raising children for 25 years. And, when my son went off to college, I don't think I mentioned that part, but it was 2 weeks before we were about to become empty nesters. And so, I was about to have more free time than I'd had in ages. And I wasn't sure what I was going to do with it. And I knew my values and interests, but I did not have a plan. I knew that I would figure it out. I figured out many life transitions before, but this one just...
Well, the universe has a way of giving us a plan when we don't have one, doesn't it?
Especially when you know what you want to do. Sounds like you're resourceful. It's awesome.
It was, and I look back on this as it was meant, to be. I think that, like everybody else, I had a few moments of disbelief and possibly some indignation in those early moments. Actually, it was actually at the appointment where the doctor found something that was concerning. It would be whatever it was, 10 days or something before I knew that it was cancer. But it was the healthiest I've ever been. I was doing all the things. And I can't tell you how many people said to me, you are the healthiest person I know. And there were a few moments of, seriously,
I'm doing all the things. Yes. What else can I be doing?
The only person who's not drinking and and I'm the one. But that's what it was. So those thoughts are normal and natural. They are not helpful or productive. And, try not to linger in them. But I would say from the moment that I found out that it was cancer, it was acceptance. And it was, I've met people who are that way. And I've met people who are angry decades later. That's fair. It's not helpful. It's not healthy. And so, from the moment it was just, I accepted it, and it was, that was my plan. That was my path. And I look back on everything, including the timing of 2 weeks before becoming an empty nester, as being a perfect plan.
Yeah. That's a very interesting reflection. And I think I'm going to ask a question, and I'm going to talk about myself for a minute, because here we are.
Let Me Know If You Need a Podcast has partnered with Sleep Again Pillows, created by a breast cancer survivor who went through a double mastectomy. And out of that experience came a pillow system that makes it easier to get real rest after surgery, something essential for anyone in recovery. As part of our partnership, listeners get 15% off the pillow system or bundle. Just visit sleepagainpillows.com and use the code GetWell15 at checkout.
So the question I want to ask you is, if you could put yourself back in the pre-diagnosis state, knowing what you know, and then prepping yourself. And as I'm asking the question, I'm thinking about myself, what would I tell myself that I think would have been helpful to get through all of the moments, right? Because I was a lot like you. I'm very practical. So very quickly I was like, okay, well, this is what we're doing. We're going to get the plan and I'm going to figure it out. And I'm not going to linger on all these things. That's not everyone. And that's fine. But I think if I were to go back and if I could sit down and be like, listen, you're going to have this problem and this is what you should do, or this is what you're going to learn. I might have to think about it a little more, but I think I would say something to the effect of this will all work out and you can do a lot of good in the world, right? Based on what you're going to experience, but try to be present What do you think you would say if you could sit down with yourself?
Yeah. What I wish I knew then is that, and I did believe that everything would be okay, but what I wish I knew is that people who have gone through breast cancer, and this is true for any kind of, traumatic life experience, you can grow tremendously in positive ways. And I'm sure you know the term post-traumatic growth. There was a study of 100 breast cancer survivors, and all 100 of them demonstrated post-traumatic growth. So, often you'll hear people say that they don't sweat the small stuff, perspective. I don't waste time like I used to. I don't know how much time I have.
Yeah. And I think that it like ties into that thought where like, because you and I are saying, we had kind of a similar perspective that, okay, I'm going to accept this. If I could talk to my past self, it would be like, everything will be fine. But like in my current self, I'm now realizing that like everything will not be fine all the time. And that's also okay. Right. Like I think that's acceptance maybe is what I'm getting at. But I think that a lot of the growth for me has been being okay with the fact that like, yeah, I'm going to live with the fear that this will come back forever. And that is perfectly fine. And I don't need to put it to the back of my brain. I can like bring that up to the front and say like, yep, this is super scary and that sucks, but here we are. I don't know where I'm going with this.
I think that I think that we all worry about recurrence. I think the rate is, I don't know, 30%, maybe even more.
Depending on type, yeah.
But yeah, I live with side effects every day. I'm tired. My cancer drug makes me tired. Mm-hmm. I have radiation fibrosis. I'm, really tight and I've got a lot of pain. My job with that is not to engage with it in a way that makes me a victim or suffering. So, I have a funky knee. I've had a funky knee for 20 years. I don't engage with that in any way. I probably walk wrong. I don't know, we've all got things. So I need to not engage with my tightness because of my cancer in such a way that I am, tortured and bitter about it. One of the other studies that was interesting is that breast cancer survivors tend to actually be happier than the general population. They report greater life satisfaction. I know. I think the data was something like 5 years out, they are as happy, and 10 years out, they are happier than the general population. So when they surveyed them, there was a study where they had 8 domains. So partner, work, family, your home, your health. How satisfied are you in this domain? And breast cancer survivors were happier, more satisfied than the general population in 7 of the 8 domains.
It's fascinating.
That's a lot.
Yeah.
The only domain where they did not report greater life satisfaction was in the health domain. But interestingly enough, they didn't rate that as highly as the general population did, right? Mm-hmm. They rated things like, relationships, friendship, higher. I love that.
That's super interesting. Yeah, I feel like I could get behind that. I'm happier because number one, I don't have to wear a bra anymore. So that is a wonderful facet of my life. Those have fallen out of my vocabulary. And number two, I don't really give a fuck. Like, I can just be myself, and not in a mean way. Like, I'm not saying like, I give a about anybody. More like, it's very nice to just be like you said, I am well aware that time can be limited. And so I can make my time a priority, as much as I wish. And I feel like it's helped me really appreciate when I'm doing something very, very well. Because then I'm like, great, I left this day I left everything on the table today, right? Like I had a great day at work. I killed it. I came home. My kids smiled at me a little. They didn't scream at me. Yes. So I think that makes me happier. But I love the fact that that's specific to breast cancer patients.
That's a great
output. Spread that to everybody.
Yeah, we should get a link to that report.
Yeah.
That's interesting.
So, Julie, what's next? Like, what are you hoping for the Breast Cancer Club?
Well, I would really like to expand the in-person component. And I know that that is not for everyone, absolutely. But for those who need it, I would really like to expand that. Right now, we're doing mall walks. It's low stakes. We meet at 9:15. We spend about 15 minutes, going around the circle, introducing ourselves. And then we walk for 30 minutes. And so that allows people then to pair off with someone that, they wanted to ask a question of or whatever. That's great. You come in your sweats, you don't have to worry about what you're wearing and all that kind of stuff. I love those, and we'll continue to try to do those about once a month. I want to do more. I want to do some educational events. I get offers, like there's Sprouts, the grocery store. They have nutritionists on site. And they will do an educational event where they'll talk about foods or supplements with cancer-fighting properties, and then walk you through the grocery store and show you, what products you can find.
Oh, I didn't know that. That's cool.
I'd love to start doing, more things like that.
That's super cool.
Yep.
So bringing more of the in-person thing locally, getting people together. Yeah.
Yeah. Some people don't want anything to do with that.
Yeah, that's fine.
They probably made an account on the website because they wanted the discounts or,
still good.
But for people who crave in person.
Yeah.
That community. Yeah.
Community connection. So I loved hearing about all of the things. We like to end all of our episodes asking, what is your favorite comfort food? No casserole required.
Comfort food. Any soup?
Do you make the soup or do you buy the soup?
I love to make soup. No, I make
okay.
soup. Yes, I love
We're
soup.
kindred spirits, Julie. I love soup.
I love soup. Had it for dinner last night. I love to make a double batch and then freeze individual portions, and then when I'm cold, just pop in some soup. I would say probably soup, but I love any kind of, I'm kind of off sugar right now, but I love any kind of
let's say in a perfect world, it didn't matter.
Apple. In a perfect world.
Yeah.
Like a fruit crisp, like an apple cobbler or a, crumble. Probably.
What are your thoughts on French onion soup?
No.
Not for you. Okay.
No.
It's a very polarizing soup. I, for one, really like it.
But you have to make it in like a single portion because you got to melt the cheese and the.
It's a high maintenance soup.
Yeah.
That's a no.
Okay.
The one I made, my last one I made is a soup version of that dip. I make it for the Super Bowl, actually. The artichoke spinach dip. You know what I'm talking about? There's a soup version of that.
Wow.
That sounds dangerous.
That sounds amazing.
That does sound amazing. Have a little crusty bread with that.
Yep.
I don't know. I will send
sign me up.
And the study that I mentioned.
Yeah.
Great. Thank you.
Okay, Julie, thank you so much for taking the time to chat with us. And we just really appreciate you being here. Everybody else, we will put links in the show notes so you can find the Breast Cancer Club. You can figure out what resources are being offered and stay tuned to see what's coming next.
Thank you so much. Appreciate the opportunity.
That's a wrap on this episode of Let Me Know If You Need a Podcast. We talked to Julie Rudman today. We found so much inspiration in what she has done, in the connections that she's making, and in how she is helping other people navigate survivorship with their own agency, making sure that this is not so hard for other people and that they don't have to do it alone. So we will share all the information about the Breast Cancer Club and how you can check that out more in the show notes. As always, if this conversation resonated with you, we would love if you would like, subscribe, and share. And until next time, remember that showing up is courageous, human, and badass.